Recognition of ultra-low breast cancer expands the spectrum of HER2 expression and provides new avenues for treatment that we will discuss in this video. HER2, a member of the human epidermal growth factor receptor family, plays a significant role in cell growth and differentiation. Overexpression or amplification of the HER2 gene leads to uncontrolled cell proliferation and tumor growth. HER2 breast cancer classification traditionally includes HER2 positive, defined by an immunohistochemistry IHC score of 3+, or an IHC of 2+ with a positive fluorescence in situ hybridization test, or FISH. HER2-Low, characterized by an IHC score of 1+ or 2+ with a negative FISH test, and ultra-low HER2, defined as having an IHC score of 0 with faint, barely perceptible HER2 staining in less than 10% of tumor cells. Some studies suggest that even minimal HER2 expression can influence tumor behavior and response to treatment, underscoring the importance of precisely characterizing and measuring HER2 status in breast cancer patients. One such therapy is Trastuzumab Deruxtecan, or Enhertu. It's an antibody-drug conjugate that combines trastuzumab with a potent chemotherapy agent. DESTINY-Breast04 trial previously established the efficacy of Enhertu in HER2-low breast cancer, providing a foundation for further studies in ultra-low HER2 populations. The trial demonstrated significant improvements in PFS and overall survival compared to standard chemotherapy, leading to regulatory approvals worldwide. A press release by AstraZeneca in April 2024, the DESTINY-Breast06 trial demonstrated significant improvement in progression-free survival, PFS, for patients with hormone receptor positive, HER2-low metastatic breast cancer treated with Enhertu. This improvement was observed in the primary trial population and the overall trial population, which included patients with HER2 ultra-low expression. The trial included 866 patients, with 713 having HER2-low and 153 having HER2 ultra-low tumors, while the sample size for the HER2 ultra-low subset was not powered to detect statistical superiority over physician's choice of chemotherapy. The results still showed a clinically meaningful improvement in PFS, according to this early report. This suggests that Enhertu could become a new standard of care for patients with HER2-low and possibly HER2 ultra-low metastatic breast cancer following endocrine therapy. These results will be presented at the 2024 annual meeting of the American Society of Clinical Oncology in June of this year. The safety profile of Enhertu in this trial was consistent with previous studies, with no new safety signals identified in this report. Results from DESTINY-Breast06 will continue to challenge our classifications of HER2 breast cancer, to the point that we'll have to consider how and when we need HER2 testing if therapies are available at all levels of HER2 expression, whether it's HER2 high or positive, HER2 low, and now ultra low. Still, I believe we need to test all patients for HER2 expression, because this is just one therapy in specific settings, and for all other patients still need to know if the tumor is HER2 positive or not. This approach has also been studied with other ADCs, and clinical trials are in progress with a variety of antibody-drug conjugates targeting HER2 with different antibodies, payloads, and linkers. Researchers are also exploring the combination of HER2-targeted therapies with other treatments, such as CDK4/6 inhibitors like palbociclib, ribociclib, abemaciclib, with immune checkpoint inhibitors such as pembrolizumab or nivolumab, and PARP inhibitors. These studies aim to improve the efficacy and to overcome resistance mechanisms commonly observed in patients with metastatic advanced breast cancer. In terms of the management of HER2-low breast cancer, I'd like to make a few points. Diagnostic precision. We need accurate diagnosis and classification of HER2 status are going to be essential for effective treatment planning. Pathologists must utilize standard protocols and advanced imaging techniques to differentiate HER2-low from HER2-ultra-low and other subtypes accurately. Number 2, treatment strategies. Integrating these targeted therapies, such as Enhertu, into treatment regimens for ultra-low HER2 patients may improve significantly patients' outcomes. Oncology should consider combination therapies in clinical trials that address multiple pathways involved in cancer progression. Number 3, monitoring of HER2 status and tumor response to therapy is crucial for optimizing treatment plans. Biomarker analysis and imaging studies should be employed to track disease progression and adjust therapies accordingly. In terms of supportive care, comprehensive supportive care services, including psychological support, pain management, and nutritional counseling, are vital for enhancing the quality of life for patients undergoing treatment for advanced breast cancer. Future research directions. The landscape of ultra-low HER2 breast cancer research is rapidly evolving, with several key areas poised for further exploration. Number 1, molecular characterization. Advanced genomic and proteomic analysis will deepen our understanding of the molecular underpinnings of ultra-low HER2 breast cancer. Identifying specific genetic alterations and signaling pathways involved in these tumors will aid in the development of novel targeted therapies for this population. Number 2, therapeutic innovation. The development of next-generation HER2-targeted therapies, including novel ADCs, antibody-drug conjugates, as well as small molecule inhibitors, holds promise for improving treatment outcomes. Researchers are also investigating the potential of combining HER2-targeted therapies with other modalities, such as immunotherapy and gene therapy. Clinical trials to include diverse patient populations and evaluating the efficacy of targeted therapies in various breast cancer subtypes will provide comprehensive data to inform clinical practice. Collaborative efforts between academic institutions, pharmaceutical companies, and regulatory agencies are essential for accelerating the pace of clinical research. Incorporating patient perspectives and real-world evidence into research studies will also ensure that treatment strategies align with patient needs and preferences. Patient-reported outcomes and quality-of-life measures should be integrated into clinical trial design and evaluation. In conclusion, the understanding and identification of ultra-low HER2 breast cancer marks a significant step toward precision medicine. By offering targeted therapies to a broader group of patients, oncologists can improve survival rates and quality of life. Ongoing research continues to refine these classifications and treatment approaches, promising a better future for breast cancer management. Staying informed about the latest developments in cancer treatment enables patients and healthcare providers to make more informed decisions, leading to improved care and outcomes.